Bose nigege karo kya humanitarian health research nigo yakoreka tamatu katatu asomo bugani yomo ime yomu chu Nairobi ase kia riganetiwe na Elfas Research for Health na African Population and Health Research Center asababu atani wetani mieye mona meronke tano bariganetiwe abubare abatuki korwa sechi skuru humanitarian na organization na bwatani bande korwa sechinse au lingana limwamu nogo kwanera amangana yogo chinja kweri ase obochenu gosegeta nawe gokwegerera ebirengo byobotuki na kubwatrana ne sector chinde eriyo gokora amanganayo.
It's a humanitarian health research forum, which really means we're gathering together to consider humanitarian needs, humanitarian response, and how that can best be informed by good evidence and good research. There are many participants from across the world, but particularly from East Africa and West Africa, and that's a major focus of our considerations. What are the humanitarian challenges in East Africa and West Africa? What are the needs, particularly in terms of emerging climate change and the climate crisis, how that's exacerbating humanitarian situations? And also, really importantly, what is the response and the capability within Africa to respond to that in terms of research institutions, working with NGOs on the ground to improve humanitarian practice.
Global health in the context of humanitarian sector. What does global health mean? Particularly, how do we decolonize global health? Right now, conversations in the international development space is around decolonization, or rather things to do with power imbalances in the global health sector across the globe. And what does it mean, particularly for developing countries, in this case, Africa? So when you get sick, for Mama Mboga, if you get sick, would you believe a tablet that has been produced in the West, or would you believe a herb that has been locally produced? For Mama Mbogas, for those who are laymen, think during Corona, we dismissed locally made vaccines and medicine, and we prioritize them over vaccines from the West. And we know now, a fact, that vaccines from the West also came with a lot of side effects to many people. So when you think of decolonization, do we need to value our own over what is coming from outside? And I think the key message to them is that not everything that comes from the West is the best. We have our own homegrown solutions that work within our context, our realities, that we need to value the most.
There are some data on mortality and sometimes on morbidity after injury, but we don't know much what happens with the patients after injury beyond this survival. So most of the patients will survive, but how will they survive? This is quite unknown in humanitarian settings, so not documented. And the research projects specifically happen in different settings. Haiti, north part of Cameroon, Burundi, Central African Republic, Yemen, and Iraq. So those were the settings that we conducted the project in.